committee will come to order. I want to welcome our witnesses here today. And this is our Work and Welfare Subcommittee hearing on pathways to independence, supporting youth aging out of foster care. So welcome our committee members here this morning, and a good afternoon to everyone. I especially want to thank our witnesses that have traveled during a little bit of treacherous weather. So I want to thank you for your commitment and dedication to getting here for this important hearing. My name is Darren LaHood. I'm honored and proud to be the chair of the subcommittee. I represent the 16th District of Illinois, covering much of central and northwest parts of our state. This bipartisan child welfare hearing marks the second that we've had this Congress, reflecting the shared dedication of the subcommittee members to address pressing issues facing foster children. Our first hearing last year, titled Modernizing Child Welfare to Protect Vulnerable Children, was held in September of last year and laid the groundwork for the committee to examine reauthorization of Title 4B, which expired in 2021. This second hearing is an opportunity to evaluate the current landscape of services available to youth in foster care and ways to redesign federal child welfare programs to reduce fragmentation and duplication. While many of our discussions have focused on young children entering care, the goal of today's hearing is to uplift the voices of nearly 150,000 youth ages 14 to 21 in the nation's foster care system, and the 19,000 youth who are aged out of care each year. Foster youth often lack strong connections to families or mentors and need support finding pathways to independence. Basic milestones such as graduating from high school, pursuing higher education, and maintaining stable employment pose distinct challenges. Many of us can recall the support of parents and teachers, neighbors, coaches, and mentors who played vital roles in our own lives. Unfortunately, many foster youth lack these critical support systems. Alarming statistics reveal the hardships faced by youth in foster care. 20% become homeless. 70% are arrested by the age of 26. Only 55% are employed, and 24% are enrolled. Only 24% are enrolled in post-secondary education or training. These statistics should deeply concern all of us. We should note, however, that some progress has been made. Last year, the Annie E. Casey Foundation released a comprehensive data report titled Fostering Youth Transitions 2023. The report highlights significant gains in improving outcomes for foster youth over the past 2 decades. These include 1, a decrease in group homes and residential care. 2, increased kinship placement for foster youth. And 3, a decrease in youth entering the foster care system. The data also highlight persistent challenges. More than half of older youth in foster care lack permanent families and age out of foster care because they were never reunified with their biological family or adopted from foster care. Many young individuals in foster care face obstacles such as severed connections with birth families, homelessness, criminal records, limited opportunities for post-secondary education and training, and challenges entering the workforce. Despite the availability of federally funded youth programs, less than half of eligible benefit from these resources. That's an alarming statistic. One stat from the Casey Foundation report that stood out to me is the finding that only 25% of youth in foster care have access to foster care services under the John Chafee Foster Care Program. The Chafee program was authorized to address specific needs of youth in foster care, yet some states underutilize allocated funds. In my home state of Illinois, only 5% of foster youth receive services at any point in their time in care. This is perplexing and should not be acceptable. Youth in the foster care system navigate a maze of federal programs, and if anyone understands government bureaucracy, it's our foster youth. Reducing overlap and administrative complexity would ease the burden on youth struggling to navigate the assistance available to them. This committee has an opportunity to ensure better alignment of programs as we consider reauthorization of Title 4B. The stories and research of our witnesses who will share today will illuminate the experiences of growing up in foster care for many youths in America. This presents an opportunity for continuing our bipartisan collaboration on this subcommittee on the meaningful solutions for America's most vulnerable children. I'm honored to welcome our witnesses today. I eagerly anticipate your testimonies, your stories, and your life experiences. And I want to extend my sincere gratitude to each of you for your willingness to be here today and share your stories. With that, I'm pleased to recognize the gentleman from Illinois, the ranking member, Mr. Davis, for his opening statement.
Thank you, Mr. Chairman, and I want to thank you for holding this hearing so that our subcommittee can hear from youth who have experienced foster care. Their voices must shape our work. To start with, though, I have to acknowledge the ongoing dysfunction in the Republican conference that continues to prevent the House from governing. Last session's chaos, infighting, and extreme proposals prevented all but a handful of laws from enactment. Today, we're just 2 days from a government shutdown, our fourth near miss. This perpetual crisis promotion prevents us from addressing real problems like child poverty, the child care crisis, and helping older foster youth. Older youth make up a very small share of the youth population, but their experiences make up a disproportionate share of the foster care system's shame. They are more likely to experience multiple placements, live in institutions, suffer abuse within the system, and run away. Each year, about 20,000 youth age out of foster care without a family or loving adult to guide and support them. Youth who age out are less likely to finish school or go to college, and more likely to become teen parents, live in poverty, endure food insecurity, and experience homelessness. These outcomes are appalling, and we must do more to help them. All of this happens even though many of these youth have loving family members or friends who want to welcome them into their families, or parents who just need a little extra help to get back on track. When we enacted the Family First Prevention Services Act in 2018, older youth fought by our side for prevention services to help families address challenges and avoid foster care. As we implement that landmark law, my North Star for action remains listening to these youth's voices as they continue to challenge us to help connect them to their families while making them and their families stronger. Foster youth have told me that they need connections with loving adults and to stay in touch with their families, especially their siblings. They need the basic building blocks of independence that all teens need: an education, a driver's license, a safe place to live, a plan for the future, and the array of supports that parents provide to their young adult children, supports that don't just stop because they turn 18 or 21. These youth need us to never, ever give up on making sure they are part of a family that loves them unconditionally. I am deeply proud to have helped shape some landmark laws to address key challenges in child welfare, including providing guardianship opportunities in 2008, helping families avoid foster care altogether in 2018, and helping older foster youth avoid homelessness during the pandemic. Today, I look forward to hearing from our expert panel and my colleagues about ways to address ongoing challenges. Despite the internal challenges facing this Congress, I believe we can make real progress to help older foster youth. I look forward to working with my colleagues to move forward and I ask, Mr. Chairman, unanimous consent to enter into the record statements from my colleagues, Congresswoman Moore and Congresswoman Sanchez. I thank you very much and yield back the balance of my time.
Without objection, those statements will be admitted for the record. Thank you, Mr. Davis, for your opening statement. We will now introduce our witnesses here today. Our first witness is Mr. Todd Lloyd, who is a Senior Policy Associate from the Jim Casey Program at the Annie E. Casey Foundation in Washington, D.C. Our second witness is Ms. Rebecca Baer, and she is a former foster youth from Tallahassee, Florida. Mr. Kiefer, I'm going to skip you for a second there and go next to Jordan Otera, who is a former foster youth from Muncie, Indiana. I want to welcome all of you here, and I'll now turn to Mr. Lloyd Smucker of Pennsylvania to introduce Mr. Kiefer.
Thank you, Mr. Chairman. It is a true honor to welcome my constituent, Will Kiefer, my friend, and his son, Kenny, here today to share their family story and their working with at-risk youth in my district in Lancaster, Pennsylvania. Will is the executive director and founder of the Benchmark Program, which is a fitness-based mentoring initiative which works with underserved youth, many of whom have had experience in foster care or the juvenile justice system. They serve over 100 young people every day through diverse programs, including weightlifting, as I mentioned. And I think we'll all learn something from Will's testimony today. I'm really looking forward to hearing what he has to say about how we can better prepare at-risk youth to transition to adulthood. I know I'm always inspired by the work that he does, and Will, I'm inspired by your heart for these young people, and appreciate you taking the time to speak with us today. Thank you, Mr. Chairman.
Thank you, Mr. Smucker, and welcome, Mr. Kiefer, and to all of you. I would also note we were supposed to have a fifth witness today, one of my constituents, Gabe Foley, who unfortunately, due to the weather, he tried to get here, multiple cancellations, was unable to, but I want to recognize and ask unanimous consent to submit his testimony for the record. Gabe is a former youth and a valued constituent from Peoria, Illinois. He is now utilizing his journey to contribute towards improving outcomes for youth in care through both federal and state policy, and I want to thank him for his commitment and dedication. With that, we'll now turn to our witnesses, and Mr. Lloyd, you're now recognized for 5 minutes to give your opening statement.
Thank you. Good afternoon, Chairman LaHood, Ranking Member Davis, and members of the subcommittee. My name is Todd Lloyd. I'm a Senior Policy Associate at the Annie E. Casey Foundation. Casey is a private philanthropy that invests in research, data, and innovations to build brighter futures for children, youth, and young adults. Prior to joining the foundation, I worked in the child welfare field in Pennsylvania, first as a county caseworker in York County, and later in statewide roles, including positions where I oversaw monitoring and technical assistance across the Commonwealth's 67 county agencies that administer child welfare programs to youth. I also served as Policy Director of Pennsylvania Partnerships for Children. Thank you for inviting me here today to provide some context about youth in foster care and programs that serve them. I'll highlight key data trends. I'll also share policy recommendations that have been informed by our work with young people who have firsthand experience in foster care. Today, nearly 150,000 young people ages 14 to 21 are in foster care. They typically have been in foster care for 25 months. Some entered foster care as very young children, others as teens. A third of the teens have experienced foster care more than once in their lifetime. The primary reason teens enter foster care is neglect, often a circumstance of family instability, poverty, and other family hardship. The committee's reauthorization efforts today can build on prior legislative reforms to Titles 4B and 4E to achieve two equally important goals for youth: preventing foster care involvement for youth whenever possible, and promoting positive outcomes for youth who do come into foster care. Briefly, here's an example illustrating how states utilize and coordinate Titles 4B and 4E to stabilize and strengthen families. Since the passage of the Family First Act, more than 40 states have taken the option to offer Family First prevention programs. The Family First Act was a significant achievement by Congress to appropriately focus on helping families sooner and prior to foster care. However, under Family First, Title 4E reimbursement for services is limited to programs that achieve a certain evidence base in the clearinghouse, and eligibility is limited to, quote, candidates for foster care. An example from Nebraska shows how Title IV-B complements Family First and can offer unique flexibility to states to provide a broader array of services that are not yet included in the clearinghouse and to families who are struggling but not yet eligible under Title IV-E. In Nebraska, nearly half of children from birth to age 5 who are in foster care have at least one parent who was formerly in foster care themselves. With Title IV-B funding, states can provide supportive community-based services to young parents before there is a crisis that results in a child becoming a candidate for foster care. In other words, Title IV-B funding plays a critical role in preventing intergenerational involvement of families in the child welfare system. I'll now share several findings from the Foundation's recent data. First, more children in foster care are benefiting from kinship connections. This is a positive trend. Today, nearly 60% of teens who are in foster care are placed in a family setting, a result of a 40% increase in kinship care over the last 15 years and federal legislative reforms to support kin. A concerning trend, however, is that permanency rates for youth are ticking down. Less than half of youth in foster care who are ages 16 and older will leave foster care to legal permanency through reunification, adoption, or guardianship. Youth mental health needs are significant and often unmet. There is extensive underutilization of Chafee services that help foster youth transition successfully to adulthood. Each year, less than a quarter of all eligible foster youth receive a Chafee service, such as mentoring and life skills training. I'll close with several recommendations. Others are included in my written testimony. We urge Congress to more closely align federal reimbursement that incentivizes desired outcomes. One approach is to incentivize the best practice of family-based foster care by delinking or increasing eligibility for federal reimbursement, which would encourage placement in family-based foster care. Additionally, increase reimbursement rates for kinship placements. Address declining rates of permanency by specifying in the purposes of Title IV-B that funds should focus on permanency goals specifically for youth, including preventing foster care. Also enhance overall performance and accountability of youth-serving programs by making the Title IV-B plans outcome-focused. Address the underutilization of the Chafee program and improve the quality, delivery, and impact of its services. I commend the committee for its legacy of legislative accomplishments to improve child welfare and welcome the chance to discuss further. Thank you.
Thank you, Mr. Lloyd. Now recognize Ms. Bear for 5 minutes. Thank you.
Good afternoon, Chairman and Ranking Member, Subcommittee, and guests on this hearing on Pathways to Independence, supporting youth aging out of foster care. My name is Rebecca Bear, and I am here to share the challenges of my journey through foster care and advocate for improvements. At 25, I stand before you as a graduate of the Florida State University, holding degrees in Family and Child Sciences as well as Sociology. I am fortunate enough to have the opportunity to participate in many local, statewide, and national advocacy organizations such as the National Youth Engagement Advisory Council, Florida Youth Shine, and today I stand before you as a former delegate of the Congressional Leadership Academy of 2023 on behalf of the National Foster Youth Institute. My journey in foster care began abruptly at the age of 16, where I was called out of class and was taken away from the only life that I had known without a single explanation. As my family faced challenges, the foster care system only further divided us. While my brother and I entered foster care, my sister stayed with my mom. The separation deprived us of sibling connections, and I lost out on a supportive family during crucial years. It took 6 years post-foster care to rebuild my relationship with my little sister, and I'm still cautious with my mom due to the scars left by the system. Entering care, I was taken into a shelter where there was a constant police presence, a lack of basic necessities such as clothes, transportation to school, and the ability to see my siblings. I had gone from living with my family who only needed minimal services to a shelter where I never felt safe and felt that I had no one. I was not given the opportunity to live with a relative, although multiple relatives lived nearby, and I remained in the shelter for 3 months. Transitioning to my second placement brought me to a more secure environment, allowing me to attend school daily and engage in life skills. Despite these improvements, the absence of a loving family's crucial support remained. While learning essential life skills, the limitations of comprehensive services and group home became evident. My brother's placement was in a foster home, though not with family, provided a more personalized and supportive environment. The lack of control over our living arrangements, coupled with infrequent and often disrupted sibling visits, underscored the challenges within the foster care system. Since it is National Mentoring Month, I want to highlight the impactful role of my mentor, Danielle, in my foster care journey. For almost a decade, she's been pivotal in my personal development, supporting me through various challenges, including driving lessons, even though she's terrified of other people driving. And no, I haven't been able to drive around since I got my license. Having a mentor when aging out of the foster care system is essential for providing emotional support, guidance, role modeling, life skill development, consistency, and trust. It significantly contributes to the successful transition to independent adulthood for individuals. 3 months before I turned 18, I visited the Florida Supreme Court and met a justice who informed the group I was with, Florida Youth Leadership Academy, that most young people in Palm Beach County had attorneys. However, I did not have one, even though my mom did, my dad, and my brother. After the meeting, I approached the justice and told her my situation, and she told me I would have an attorney the very next day. True to her word, I received a call from my attorney, which was a big game changer in gaining legal representation. My attorney made sure that I could obtain a driver's license, reconnect with my family, and navigate aging out of care. A few weeks after I turned 18, my brother returned home to my dad and is now a successful student at the University of Florida while playing the timpani around the country. I am a determined adult who navigated extended foster care until college, graduating in 2020 with 2 bachelor's degrees, thanks to programs like Best Foot Forward, Vita Nova, and the Unconquered Scholars Program that assisted me with FAFSA, scholarships, and budgeting to the point that I became a homeowner at 21 and was able to study while enjoying the student life on Florida State's campus. Exiting the system, many youth are not encouraged to pursue secondary education. Assistance with FAFSA or applications became a daunting barrier. Despite campus coach legislation, robust campus support is inconsistent. I advocate for funded legislation ensuring well-trained individuals, additional support, and lower no-cost housing with meal plans for foster youth at every institution. As part of the 5% of foster youth with a 4-year degree, I stand as a testament to resilience. While acknowledging my success, I urge the committee to consider systemic changes for others in foster care. My powerful ask is for comprehensive, empathetic policies that empower foster youth, creating a pathway for success beyond the challenges of foster care that utilize diverse youth with lived experience voices. Suggestions include placing with relatives or in-home support services before being taken out of the home. My experience traveling 40 minutes to school emphasizes the need for programs like Keys to Independence, as I was often left waiting for a bus that never came. I want to express my gratitude for your time today as I advocate for transformative reform, and I hope that my story leaves you inspired to create meaningful change. Thank you.
Ms. Baer, thank you for sharing your powerful and successful journey. We'll now turn to Mr. Kiefer. You're recognized for 5 minutes.
Good afternoon, Congressional Committee members. I will not be the most experienced or credentialed witness you will hear from today, but I will be the sole witness who has spent the last 10 years of my professional career building a system of programs that allow me to stick with at-risk youth through the toughest parts of their lives. My name is Will Kiefer, and I am the Executive Director and founder of Benchmark Program, a space where juvenile offenders, foster youth, and youth who have dual involvement in both delinquency and dependency systems can call home. Benchmark Program is a gym facility, a lounge, a tutoring center, a kitchen, and a career development provider. On any given day, we operate 7 separate yet interconnected initiatives. We provide youth with a consistent mentor who remains connected to them for years at a time, program after program, helping them navigate life's complex challenges well beyond their 18th birthday. I'll tell you first about Julius, who is 18 years old and has been in foster care since he was 11. When I first met him, he was confined to our local detention center and shelter. Julius had been removed from a foster home and put into a group home where he fell in with the wrong crowd and ultimately committed a gun crime. He had no prospect of being accepted into another foster home, and no idea how to navigate both the delinquency and dependency systems. He had a lot of people telling him what to do, but very few people helping him to do any of it. Over the next year, Julius walked step by step through 5 different initiatives at Benchmark Program without a break in services. We ultimately offered him a part-time job at Benchmark, and now he is a high school graduate living in a group home and looking for his first full-time job. We continue to work with him daily. He gets the undivided attention of his mentors, Anna and Kathy. They are his navigators, and they will stay involved with Julius until he tells them that he no longer needs their support. And then we have Shyla, who is about to turn 18 years old while out on the run. She couldn't last in any of the 10-plus foster or group homes where she landed. Some of the fights she started there earned her criminal charges. Every time that she returned to our local detention center, though, we engaged her in our programs. We became the only consistent home base in her life. Her release to our facility and our programs was one of few opportunities that she had to combat institutionalization. After serving as a keynote speaker in front of 600 juvenile justice practitioners at a statewide conference last November, Shyla ran away from our facility one evening with nothing more than the clothes on her back. The upcoming move to another group home and some of the good things happening to her were too much. She chose the comfort of old, toxic peers over the challenge of life as a young adult in a group home. Then, out of the blue, she called me last Wednesday night as I was writing this testimony and asked if she could come back to Benchmark. She apologized and asked when I would be in the gym next so that we can meet and make new plans for her future. We picked a date, and I promptly edited this section of my testimony to reflect this new twist in her story. Finally, sitting behind me today is Kenneth Jackson Kiefer, my son. I am taking him back to Washington College for the second semester of his freshman year right after this hearing. He was introduced to Benchmark at 14 years old after losing his biological father and brother, and later his mother. For a time, he too was on juvenile probation. My wife Carla and I fostered Kenny at 16 and ultimately adopted him, helping to prevent him from aging out of foster care himself. He's taken advantage of every opportunity available to him at Benchmark program and beyond, and I'll let him answer any questions that you may have for him once I conclude. Here's what I would ask this committee to remember. Number one, no one is ready to be an adult at 18 when they are told they're an adult and told to prepare to live on their own. Complete freedom is not what any of us need at that age, no matter what resources are promised to us. Number two, unless you are an individual with incredible persistence and system know-how, youth cannot access resources made available to them as they age out of care. They need a navigator who knows the ropes, has learned the system, and can lead them through the tangle of paperwork and processes to get them what they need. And third and finally, any program or system that we build or fund to serve youth aging out of foster care needs to be intentionally designed to pair youth with a singular, long-term mentor across the span of years. This is the gold standard. In this room today, we are gathered to discuss a complex, multifaceted problem involving some of the most traumatized, unpredictable, and challenging youth. We are well-educated, well-funded, and well-connected. We will solve this problem. We will solve it as soon as we realize that what has allowed each of us to successfully transition from adolescence to adulthood is the same thing that youth aging out of foster care need. Namely, it is the presence of a consistent, reliable, available, long-term mentor who can be trusted to pick up when a kid calls year after year after year until that kid finally gets across their chosen finish line. What is keeping us from building that type of support into our programs, our system, and our society? Answer that question, and we will have solved this problem.
Thank you, Mr. Kiefer, for sharing your inspiring story of you and your son both, so welcome. We'll next recognize Mr. Otero for 5 minutes.
Good afternoon, Chairman LaHood, Ranking Member Davis, and members of the subcommittee. Thank you for inviting me to be here today to give my testimony. I am here today to share my experience of how family connections, financial resources, and peer support programs have helped me navigate the world in and beyond foster care. My name is Jordan Otero, and I am 24 years old. I graduated from Ball State University with my bachelor's degree in general studies with a concentration in social work. I am now a case manager at Georgia Junior Republic, an agency in Indiana, where I support children and youth who are experiencing foster care. I am also a father to my 2-year-old son. What I'm going to be sharing today is by no means the average experience of foster care. I am blessed and very fortunate and very lucky to be where I am today. With that being said, I know oftentimes it is the sad stories that are told when we talk about the foster care system, but today I would like to highlight the positive impact of relationships that I have built, the financial support that I have received, and the programs that I've been a part of that all helped me succeed in my early adulthood. My foster parents are some of the greatest foster parents ever. They have been very supportive in my life after foster care. To this day, I have maintained a great relationship with them, and my foster dad and I talk on the phone every Friday. My foster parents are people I can lean on for advice and support when I need it. I stayed with my foster parents until I started college at Ball State University. I relied on their support and a program called Summer Bridge that is ran by Foster Success in Indiana to prepare for my freshman year. Summer Bridge provided me with the opportunity to stay on campus of a college in Indiana and earn college credits the summer before my freshman year of college. This allowed me to get adjusted to the college lifestyle and have a head start in my education. During this time, I turned 18 and decided to enter the collaborative care program in Indiana, which is Indiana's extended foster care system. While living with my foster parents, I also joined the Indiana Youth Advisory Board. I found out about this meeting from my family case manager, who sent an email, and it was titled Free $40, Go. Little did I know that this youth board would be the start of my advocacy journey. The Indiana Youth Advisory Board allows a space for teens and young adults with lived experience in foster care to connect, share, and grow with each other. It also empowers foster youth to advocate for themselves and communicate their needs and concerns effectively. I am still involved with Foster Success, who runs the Indiana Youth Advisory Board, and I now serve as a lead ambassador where I help younger youth prepare to engage in the board and advocacy. One thing I would like to highlight is that my foster parents helped me in getting my driver's license and covered my insurance while I was living with them. Once I went to college, however, I couldn't stay on their insurance and I wasn't sure how to get on my own. I was embarrassed to ask, and then I ended up driving without insurance. I lost my license for 2 years for 2 counts of not having insurance, and during one of those times, I was involved in an accident. I was then faced with the same reality that my fellow peers in the foster care system had, forced to rely on public transportation, if there is any where you live, asking people for rides, and owing them favors, the feelings of being a burden to others, the feeling of being inferior because I couldn't do what most normal college kids could, or the worst is that some of my peers decided to drive without a license and dig a further hole that they couldn't get out of. I was blessed with the fact that I knew I could get my license back and that I just had to pay my insurance. I knew it would end, but the sad reality is that some of my peers to this day can't get their license. Now in Indiana, though, that has thankfully changed. This past year in Indiana, I advocated alongside Foster Success for the development of the recently implemented Ensuring Foster Youth Trust Fund and a $2 million state appropriation to support behind-the-wheel driving hours and offset auto insurance costs for older foster youth to allow them to more easily get to school and to work. I believe that all states could benefit from this model that Indiana has and that every older foster youth would benefit from something like this. I started by sharing that there are 3 things which contributed to my successful transition to adulthood. It is the relationships that I have built, the financial resources that I have gained from, and the programs that I've engaged in my lived experience. I believe that all foster youth need these 3 things in order to be successful, and there are 3 ways to accomplish this. Prioritize relationships and the family placement for transition to youth in foster care. We need relationships and supportive adults who will last far beyond our time and care. Invest in the financial resources that meet the various needs of young people while we pursue higher education or the workforce, or just finding our footing as young adults. Ensure all young people in foster care have access to the network of peers and supportive adults. This can be through the youth advisory boards, the peer navigation programs, who can help us find those right resources, or campus supports. This is critical to reduce the isolation of being in foster care and empowering us to improve the foster care system and those who are still experiencing it. Thank you for having me today. It is truly an honor and a blessing to be here. 5 minutes is not enough time to give you the full scope of the foster care system and what children and youth experience. So I urge you to meet with your lived experience youth in your home state and hear their stories and see who they are. I want you to have the understanding that our stories are more than just testimonies and sad news articles you see. But we are people with dreams and ambitions. We are people who break the cycles of poverty and dysfunction. We are people who have achieved many successes and received accolades. And with the barriers we have faced, it doesn't always make sense for us to be here. Yet, I sit here today alongside my peers and others that we are able to be here, and we will continue to make success the expectation and not the anomaly. Thank you again.
Mr. Otero, thank you for sharing your personal story and for your passionate leadership and advocacy. So we're grateful. And to all our witnesses, thanks for your testimony. We'll now proceed to the question and answer session with the members that are here today. And I'll begin by recognizing myself. Mr. Lloyd, I'll begin with my first question for you. You provided a policy recommendation that Congress should look to reimagine child welfare financing to incentivize delivery of effective services. And I appreciate your, big picture view that you outlined. As has been mentioned, this subcommittee is working on reauthorizing Title IV-B, which we found is an important flexible funding stream for states. But it's also outdated and duplicative in some places. I'm curious your opinion on what we can do to make sure Title IV-B is modernized so it works better for our youth, and particularly foster youth.
Thank you, Chairman. Yes, and I think there's things that will echo probably from September when you heard about the opportunities to streamline and make Title IV-B more outcome-based and efficient. We would also suggest the reinvestment and a redirecting of federal and state Title IV-E savings from reductions in use of foster care and group home placements into Title IV-B placement. So there's this relationship between Title IV-E and Title IV-B, and so incentivizing greater performance from both titles by making appropriate investments in 4B. Federal increasing to Title IV-B programs that are tied to the performance, ensuring that a rate of expenditure under Title IV-E prevention. So as states have this new opportunity under the Family First Act to spend on a Title IV prevention. So far, 6 years in, we have about a 1% of total federal spending in that 4E prevention program. So could we incentivize more 4E prevention through increasing Title IV-B investment and kind of coupling those things together? There's opportunity to modernize and align both 4B and 4E to also allow a broader continuum of prevention investments, and it sort of relates to the illustration from Nebraska, that there are times when Title IV-E prevention services can't be used for certain families. They're not eligible because their children are not quite on the verge of entering foster care.
Thank you. I appreciate that, Mr. Lloyd. Mr. Kiefer, I'm now going to turn to you. In your testimony, you underscore a lack of communication and knowledge about the rights and opportunities and the need to create creative and be creative about engaging with youth. So they are receptive and see the value in these programs. With your extensive experience guiding teens to be successful in adulthood, I can imagine the underutilization of certain programs is not unexpected. In your opinion, what steps should be taken to ensure that children in foster care are informed about the tools and resources available to them?
Thank you, Chairman LaHood. This system is more complex than even I can wrap my mind around, but if I were to boil it down to one thing, based on the experiences that Benchmark has in the individuals that we serve, it is the connection to a singular mentor for a long, long period of time. And we've managed that by creating programs that kids step through so they don't have to be transitioned to another organization. But I think that that underlying message holds true here. We can work on the system itself, which to me seems to be a largely static thing, or we can invest in very dynamic individuals who serve as navigators, who they themselves understand exactly how to work through things so that kids get what they need. And to me, that sounds like certainly an area of focus for us on individuals.
And just to follow up on that, in terms of the practicality of how we implement that, what do you think are some of the attributes of benchmarks that make youth stay engaged?
We generally hire a younger demographic. We hire young people who are a little bit older than the teens that we serve so that they feel a quick connection to them. We have extensive training so that they understand the systems that they're involved in. And then we pay them a very reasonable salary to do this work so that they are not looking for a job elsewhere, that they feel they can make a career out of committing long-term to serving the individuals that we pair them up with. These are also known as credible messengers, so oftentimes the people we hire have grown up in the community where those individuals grew up, so that they have an immediate connection and understand things that maybe I wouldn't understand as someone who comes from another community.
Thank you for that. Mr. Otero, in your testimony, you shared that the Youth Advisory Board showed you the difference that sharing your experiences could make. Can you provide an example of a policy the advisory board asked you to provide feedback on and how it impacted the state child welfare system in Indiana?
Oh, that's taking me back a few years. Well, I don't know, other than the Driving Act is probably the most recent one I could really speak of, was being able to just talk to everybody and share an experience about how the difference between cost of insurance for just a regular 19-year-old on their own plan compared to a 19-year-old on an adult's plan, and the cost variation. I mean, it's 3 times as much for just any 19-year-old to be on their own plan, and depending on other factors, it could be even higher. So I was able to just really share that impact that can have on someone's financial status. So other than that, I've really worked with the board to just talk to other foster parents. I did foster parents training when I was on IAB, and I got to really talk to those foster parents and tell them what my great foster parents did for me and how you can communicate with us in different ways and things like that. So
And what we found is not every state obviously has youth advisory boards similar to what you talked about in terms of your own experience. Would you be an advocate for states implementing a youth advisory board?
Absolutely. I think not only does it provide you with the peer support, I've met a lot of my friends are from that board, and we have continued to do other coordinating programs all throughout the country together to this day. And so not only did it grow great peer relationships, but it keeps those relationships in state. In your own county, you're able to then start programs or get things running off the floor. And then, I mean, the people who run it, Foster Success, They provide you with opportunities now from the age of 14 all the way to I'm 24 now. So I could have theoretically, if I started now, it would be 14 to 24. That's a 10-year span of having one individual entity involved in your life that is so consistent and I think is pivotal for these kids to succeed. And so I really love what our agency does in Indiana. So
Thank you for that. I'll now recognize Mr. Davis for 5 minutes.
Thank you, Mr. Chairman, and let me thank each one of you for your moving testimonies. And if I don't get to all of my questions, just know I'll be calling you. Ms. Baer, you mentioned how critical help is with getting one's driver's license and how much independence it gives to a person. Can you talk a little bit more about how that really zeroes in on what a young person needs?
Yes, thank you. So in the state of Florida, we have a program called Keys to Independence that was helped to be created by Florida Youth Shine, which is a youth-led, peer-driven organization. That they ended up creating this amazing program that works with young people aging out of the foster care system, gain their driver's license, car insurances, and more. When I turned 16, this program wasn't put into place yet. And when I was aging out, there was a small pilot program in Orlando, so I still didn't qualify for it. And then by the time that I was turning 21, I no longer met the requirements. So regardless of this going statewide, I was ready to drive the moment I entered into foster care. I had my driver's permit from the second that I could take that test. But I was hit with multiple barriers, unable to get my birth certificate or social security card, and was met with barriers because I didn't have an attorney fighting for me. And by the time, the way that these licenses would have helped me is because I had to meet ratio in order to go to swim practice, to go to school, to ensure that I had a staff member that could take me anywhere. I missed out on activities. I missed out on debate tournaments. I missed out on being able to be just have normalcy. And I often missed school because I was waiting on a bus that often didn't show up.
Thank you very much. Mr. Otero, you mentioned some experiences with driving. You have anything you'd like to add to that?
yeah, so many of my peers struggle to find adults willing to help with the driving hours or the insurance, which has been mentioned. DCS, the Department of Child Services in Indiana, only pays for 6 of those hours needed. But now with this Ensuring Foster Youth Trust Fund, it has been able to help pay for those remaining hours. But the reality of it is that a lot of the foster parents, when this whole thing happened, when my foster parents decided to help me with driving, they didn't even know if they actually could. So that was a barrier itself, is what can our foster parents do? And if they can do it, I think a lot of them would. And if they were able to be talked about how impactful this could be, that they may be able to take that on themselves. So I just think the communication barrier lies there.
Thank you very much. Mr. Kiefer, you and I seem to share a common passion in terms of work with individuals who've had some difficulty with our justice system. How do you reconcile and work with those individuals to be most helpful?
Thank you, Mr. Davis. It's a belief that we at our organization share, that our efforts should be focused on the disproportionately small part of our population that does a disproportionately large amount of damage to our communities. If we focus our resources there, we can have great outcomes that spread across the community. And the last thing that those young people need is another program that they need to jump hoops through. They need someone to say, all right, I'm in your life now. I will take it from here. You keep doing what you're doing, do the right things. I'll navigate the system. We'll get you to your desired outcome. That's what keeps us so motivated to work with that population.
Thank you very much. And Mr. Lloyd, I know that I'm about out of time, but I'm very familiar with Casey and the work that you've done for years and years and years. What would you say to us that we can do to really help young people aging out?
Yeah, it's a great question. I think really leveraging this fantastic opportunity under Title IV-B and the reauthorization to make young people a priority. Currently, Title IV-B, you're not able to actually provide services to youth over the age of 18. And so there's opportunities to both, like I mentioned in my testimony, to prevent things and promote things. And it's the kind of the combination of 4E and 4B investment together.
Thank you all. Thank you, Mr. Chairman. I yield back.
Thank you. Pursuant to committee practice, we'll now move 2 to 1. I'll recognize Dr. Winstrup of Ohio.
Thank you, Mr. Chairman, and thank you all for being here today. I think it's important that we learn from the past, modernize our welfare system as best we can. And so I thank all the witnesses here today for discussing your angles of this experience along the way. You know, you think of drop-in centers, and we have one in Cincinnati, and a lot of places have it, and what you always come away with from the adults that are in there is, where were you when I was young? And I think that that's the key. And I know that you're all over that. To think that there's nearly 19,000 youth that age out of foster care each year without a strong connection to a family, a mentor, or other adults, that really is something we have got to address. I can tell you, at 18 years old, I was not ready to be without my parents and to be completely independent. And that is just a huge component of a successful life beyond. So the permanency of these types of things, I think, is really important. You know, one example of modernizing services over time is an example of Boys Town. Maybe you're familiar with Boys Town in Omaha, Nebraska. Started about 100 years ago, mostly comprised of orphans and runaways from reformatories. And Boys Town is still out there in Omaha today. It's their own city. They have their own fire department, police department. But one of the things that they have done, besides being so helpful to that population for many, many years, in 2008, they directed some of their focus, additional focus, serving children while they remained at home with their families. So reaching out beyond just come here because you have no one else, right? So some people have families, and they reached out, and they found it to be cost effective. You talked about success, outcomes based. They can say that by 2013, 92% of children who received services from Boys Town were children living in their own homes. That's a component we address too. At home, I've been involved for 30-some years with Boys Hope, Girls Hope, where parents say, we don't have the best environment for our child. They go live in this home. They're not taken from their family, but they live there, they're mentored, they're safe, they're secure. They get tuition to go to generally private schools. It's basically a scholarship. The outcomes have been tremendous. So those are things that we realize what is necessary for success. And I think that that's what we need to keep focusing on, and that is good support while you're in it, and good support when you reach age 18, or allow provisions like I think you were on insurance when you were with them, and those are great examples. So Mr. Kiefer, based on your extensive experience with the foster youth, do you think there's a necessity for redesigning, modernizing our federal programs catering to youth? I mean, I hear good things like the Youth Advisory Board. Basically, what it sounds like you're doing is see one, do one, teach one. Come back and help the next person along the way. To provide a consistent, reliable, trusted family atmosphere. And so what do you recommend that we might be able to do here to make that more feasible?
Thank you, Dr. Wenstrup. I would encourage this committee to truthfully think simplistically about this. Mm-hmm. We understand what the gold standard is. You just described it in action in Boys Town. It is the connection to a singular or small group of long-term mentors who will be there for years. I'm not sure why we can't build that into our systems. It may be much more cost-effective than working on tweaking a system as a whole. Again, I believe the system can generally be a static thing, but an individual who navigates the system on someone's behalf is dynamic and can change with the times, and we can teach them new things and they can adapt to new systems. Boy, I wish that kind of job would have been available to me when I got out of college, to be a navigator for kids in that.
Well, and you mentioned too, understanding the tools available.
Yes.
Because it's not one size fits all necessarily. And but that singular mentor, I think is huge.
Right.
So thank you. I yield back.
Thank you, Dr. Wenstrup. Recognize Mr. Carey of Ohio now.
I want to thank the chairman. I also want to thank the ranking member for having this hearing. And I also want to thank all of you, the witnesses, for testifying here today. Your willingness to share your stories of how foster care system has impacted you is truly inspiring. And I'll tell you, Ms. Barrett, you may have missed a lot of debates, but I'll tell you what, nobody could be prouder of themselves in the job you did today, and really appreciate your testimony. You know, I have a 22-year-old son. I have a 4-year-old son and a 2-year-old son. Big discrepancy in age, but you know, my son's about ready to graduate from college, and you know, he has a full-time job, works at our State House in Columbus. But I will tell you, it's not always easy to navigate that transition from being a youth and in school and then going into your career, no matter, regardless of your circumstances. And I understand that foster youth face unique challenges when transitioning out of the foster care. And Mr. Kiefer, I really appreciated you giving us the 4 bullet points that you wanted us to take away. And I think the one that really resonated with me was the long-term mentor. Because, Mr. Otero, I'm glad you speak to your foster father every Friday. If I could get that from my 22-year-old, I would be very, very happy. Mr. Lloyd, listen, the challenges of youth, you know, accessing available services appears twofold, involving foster youth not always being aware of those services and the state's underutilizing programs like the Chaffee program in Title IV-B. What do you believe contributes to states not fully taking advantage of these programs to serve our youth that are in the foster care?
Thank you, Representative, for the question. Yeah, I think you, like in your question, I mentioned the lack of awareness, and I think that's something we hear time and again from young people. So I think a good starting point there would be just expecting states and encouraging courts to make sure young people are informed of what is available in their states. There is funding constraints as well with these services. The Chaffee program that was mentioned earlier is 25 years old. The funding initially came to states in the mid-'80s. It was doubled in 1999, but it hasn't had an increase since then. But the eligibility for Chaffee has grown significantly. Under the Family First Act, there was a real recognition that all young people ages 14 and older in foster care should be receiving these services to promote their well-being, as well as to promote connections to caring adults, to that individual, to a permanent relationship. So there is that kind of diluting effect of the program right now because we've had that big increase of eligibility, but no real increase in funding. I'd say also the lack of alignment between the services and what young people recognize as the highest needs that they have. And so it's just another good example of why we need youth advisory boards and youth input in the design of these services.
Oh, thank you for that. Mr. Kiefer, does your program benchmarks utilize any metrics or outcome measurements to gauge the success in supporting foster youth on their journey to independence?
Yes, and the metric that I think matters most to this discussion is the amount of time that we track that a student and their mentor have at least one face-to-face interaction per month, and that's 38 months on average. So over 3 years on average that our individuals are connecting with their mentor. We've done that organically. We built a program to make that possible. But there's no reason that other communities couldn't do that exact same thing, or that we as a committee can't build our systems to drive that kind of long-term interaction. Now, we certainly have other metrics that, 92% of the kids who have offended when they're in the program don't reoffend. 77% of the kids who come into the program with truancy issues start going back to school once they're in the program. And we have a whole list of these that's in my written testimony, but the point is, those things are not because the kids sat through a 6-month mentoring program where we talked to them about life skills. Yeah. It's that they had a mentor to say, all right, now the lesson's done. Are you going to go to school tomorrow?
Right.
Do you need me to pick you up from your house? Because if that's what it takes, that's what I'll do. And that's the key.
Listen, I want to thank all of you for making the trek here. I mean, it was difficult for me to come in from Columbus this morning, and I know how hard it is. But your testimony, your written testimony, our staffs read it, we read it, and we appreciate you taking the time. So with that, Mr. Chairman, I yield back.
Thank you, Mr. Carey. Recognize Ms. Chu of California now.
Well, I want to thank all of the witnesses for your very important testimony, and especially the foster youth for sharing your stories of how you came to be the successful young adults that you are today. Your testimony supports something that I'm very proud to announce, which is the introduction of a bill that Representative Aaron Houchin and I are introducing, which is the Increasing Access to Foster Care to 21 Act. This bill would provide a financial incentive for states to extend foster care beyond age 18, building on years of research that shows that extending support into the first few years of adulthood can make a clear, positive difference in the lives of young people. In fact, 28 states, the District of Columbia, and 9 tribes have already extended Title IV-E foster care for youth beyond age 18. But not all states have opted to extend this support, which means that too many foster youth lose supportive services as soon as they turn 18. The Increasing Access to Foster Care to 21 Act would ensure that states receive federal reimbursement for all youth in their care up to age 21. Mr. Chair, last Congress, nearly 100 child welfare organizations on both the state and federal level endorsed my legislation to extend foster care nationally, and I would like to submit this letter of support from them for the record.
Without objection.
Mr. Lloyd, we know that extending vital services to older foster youth can have a long-lasting positive impact on their lives. However, in your testimony, you reference the barriers that face youth who want to continue those services. I know that that there was one study that showed that extended foster care benefits are such that youth have to qualify first, and they have to qualify with such things as enrollment in college or vocational program, employed at least 80 hours a month, or have a medically noted exemption, which can be indeed a barrier. So can you explain more about these barriers and what positive impact would reducing these barriers have on youth transitioning into adulthood?
Thank you, Representative Chu, for the question. Yeah, of all the young people who are eligible to extend in care past age 18, less than a quarter will be still remaining in care by age 19. So even though more than around 30 states have taken up Title IV reimbursement, there's still not enough utilization of this program, yet the outcomes are very clear that it's helpful to them. And so, yes, I think there are definite barriers. I think sometimes it might be barriers related to awareness of some of the opportunity to extend, the design of the services themselves, but there's also some financial kind of challenges as well, the eligibility to be reimbursed in a state. If the young person actually works to meet that criteria, their income might be such that they are no longer Title IV eligible, which then inhibits the state from actually affording that cost of extended care. So there's definitely some challenges with the eligibility that could be improved.
Mr. Otero and Ms. Baer, thank you for being with us and testifying about your experiences. And, well, Mr. Otero, you have experience with Indiana's extended foster care program. Can both of you expand on how choosing to be in a program that can extend services beyond 18 help advance foster youth's success in life?
Without it, I would not be here today. I would never have been able to pass college. I made a lot of mistakes my freshman year, as a lot of college kids do. I partied way too hard, and I was failing a lot of classes. But I was able to receive tutoring and mentoring services. I was then able to then have access to the education and training voucher. That is, Foster Success handles that. But without that, I wouldn't be able to pay for the summer classes to help get me caught up. And due to those intense mistakes, I had to, every summer until I graduated, take those summer classes. But without that money, I wouldn't be able to pay for that. So I just, that extended service kept me, not only did it keep them involved in my life, and I had someone to help keep me accountable, but it just helped me with getting to that point where I needed to. So,
Ms. Baer?
Really quickly, although I didn't know that it was an option to leave foster care when I turned 18, so I did enter into extended care, it helped keep me in one place and not have to move until I went off to college that summer. And so made sure that I had a roof over my head and food for me as well. And had a couple of supports and kept me with my mentor.
Thank you. I know you're back.
Thank you, Ms. Chu. Now recognize Mr. Moore of Utah.
Thank you, Chairman. Thank you for hosting this. Thanks for being here. Mr. Otero, don't beat yourself up too much over that freshman year. It catches a lot of folks. I recently, I feel very fortunate to be on this committee, on this subcommittee. Very seldom in life does something kind of stick with you for more than a few years on a particular issue or something you're working on. And since I was like 17 years old, completely different situation from what you two have dealt with. I've been able to be close to this issue by engaging with organizations that support this in various ways and in various levels of intensity, sometimes very close and doing a lot of work in particular, or being a little bit more distant. But it's been something that's been constant to me. It's an emotional issue. I had a group of teens in my office the other day, and I remember telling them, don't let this define you. As they're introducing themselves, they oftentimes define themselves as this. You're just a freshman in college. When it all comes down to it, you've got your own path, and you're an inspiration to so much of us that are trying to build the right policy so we can do this. The data on this is staggeringly dangerous. If we don't figure out how to help foster children find more permanency, find that forever home, that forever family, the outcomes are so scary. They're not just small percentages of people that get involved in drugs and homelessness and legal issues and death. This is a huge number. And so thank you for staying close to this. Thanks for helping this issue and helping us figure out how to go about doing it. To put a little context on this, Mr. Otero, just share with us briefly from your testimony, just you were separated from your 7 siblings, is that correct? And just kind of tell me how those separations impacted your transition into adulthood.
So, with the separation of me and my siblings, I took it as I didn't want to mention it today during the speak, because it meant a lot to me to have the relationship with them, but we all took different paths in life. I'm one of 8 children from between my mother and my father who have been able to not only graduate high school. I was the first one to graduate on time between me and my siblings and my immediate family, but I'm the only one to go to college and graduate with a bachelor's degree. And so I'm blessed to be where I am today, but seeing what my siblings went through, I was able to navigate the system when I went into the system at an older age. They had all experienced terrible things they were much older than me when they went in the system. So they had all experienced terrible things. I saw what it was when they ran away from the system, and they stayed on the run until they turned 18. 3 out of 4 of them did. Only one of them aged out, but immediately that sibling did not want to have anything to do with DCS after they turned 18. Even though they knew that they had services accessible to them, they couldn't deal with the stigma of how DCS was attached to them. So I've witnessed firsthand the negative things that come from that, and I'm just blessed to be here today.
And many of the things that you've highlighted follow the trends and outcomes that we see with transition-age foster youth. Mr. Chairman, I would like to submit for the record the Annie E. Casey Foundation on Fostering Youth Transitions 2023 report.
Without objection.
This report highlights a trend of child welfare systems failing to find permanent families, forever families for young people. Yet we know that children who have these forever families to support them have better young adult outcomes, including housing stability, educational attainment, some of the things, and employment that I discussed. And I just appreciate you for your testimony. Mr. Lloyd, similar to previous questions, but could you just add a little bit more context on evidence of generational cycles where children who were once in foster care, particularly those in child welfare setup, end up involved in the system again when they have their own children? And how can we address this cycle proactively from a prevention forward perspective?
Right. Thank you for the question. Yes, young parents need more options to receive support and from trusted sources for sure. And 26% of young people, older youth who exit foster care will be parents by age 21. And so I think, again, relates back to the Nebraska example of how we need to be supporting young parents and young parents who are expecting parents in foster care. I'd also just like to say, in relationship to your mention of permanency, that the testimony that I had shared really talks about kinship foster care, and we really need to stay the course in prioritizing family for young people, and particularly connecting them to their relatives and other members of their kin as placement settings. There's been a number of things that Congress has championed over the last 15 years with supporting kinship guardianship assistance, navigation programs, family finding and search requirements to identify relatives, and the data is paying off. It was a 40% increase. There's been no increase in non-relative foster care for youth over the last 15 years. That total increase in permanency and placement setting has been because of kinship.
Thank you. Thank you all. Thank you, Chairman.
Thank you, Mr. Moore. I recognize Ms. Steele of California.
Thank you, Mr. Chairman. This is a very important issue that I served at Family and Children Services at the county and LA County and Orange County level. So I know that how these foster cares, when they get out of foster care system, and LA mostly, a lot of kids become, joining gangs, or a lot of actually kids become homeless people there. So we really have to work together bipartisan way to supporting young adults who transition out of the system at critical times in their development, because that's very, very sensitive age, and they think they know everything, but at the same time, they don't know anything. So that's the way it is. And all the witnesses, thank you for coming. And this is very important issue. And this is the one actually that, we can make our youth grow, and we're gonna make a bright future for this country or not. So I am very much concerned about that. But it's really interesting to hear from Mr. Otero that, coming out today, I really appreciate it, that sharing your perspective and journey with all of us. And I really praise you that you graduated from college, and out of all those siblings that you really got out of it and you did really well. I just want to see that what specific challenges do youth in foster care encounter when seeking obtain a driver's license? And were there notable roadblocks that differed from those faced by your peers? On the top of it, your state has foster youth trust funds that helps. In Southern California, we don't walk more than 1 block. We all need cars, and these kids get out of the foster care. They really need a car to drive anywhere in Southern California. So love to hear a little bit more about that system, that how they really help and how that, they can work with those kids.
So in Indiana, the people who are going to be navigating the program for the Ensuring Foster Youth Trust Fund, they do a really good job of connecting with the youth at a young age. And to help eliminate some of the barriers, my job as a home-based caseworker, I work with foster youth. I try to inform all the foster parents and the biological parents when they get the kids, because it's going to be eventually, if kids get reunified, they have to then handle that, right? But it's learning, what can you do as a foster parent? Can you sign a right to say, hey, I take legal responsibility for this kid? Sometimes they say it's the FCM, the family case manager's responsibility, because you're the ward of the state. They're supposed to have responsibility of you. So sometimes it gets in a little gray area there. But in Indiana, we've also waived the driver's license fee for youth searching for their driver's license. So that it's a small cost, but it is a cost that is nonetheless paid for. And there's still problems with that. The BMV, depending where you go, doesn't even know that that's a thing. So they have to then ask another higher up, and it goes through a chain of command that loses communication the whole way through. So the number one thing that I think that can help is getting people like myself, people who have experienced the system and people who have helped testify on these things, to advocate throughout the state and just inform them. We know that DCS meets, and that we can go to those conferences, and we can then tell them that these are the things that are going on that everyone should know, and that the family case managers, the collaborative care case managers should know.
Thank you for that. And there seems to be a great deal of misinformation when it comes to foster youth accessing the services, even questioning if they were real. What were some of the misconceptions around assessing services, and what do you think is contributing to the misinformation, and how are we going to solve that?
Yeah, so a lot of times people are like, oh, I didn't know about this. I didn't know that foster youth can get almost free college by the Indiana 21st Century Scholar. I didn't know that the education and training voucher was a thing. What attributes to a lot of it is that there's a high turnover rate in our case managers in Indiana, well, everywhere actually, high turnover rates, and whether that be attributed to the stress of the case and that you're dealing with real people with real problems, that is a real thing. But if we can just get people in positions to communicate these things effectively, and when you go through foster care, and that there's many different people in a foster youth's life. There's the LCPA, the licensed foster care agencies. At times, there's my job, the home-based caseworkers, the FCMs. Then you have the judges. Having someone to get them all together to inform them of what's going on is the best way to get that communication right.
Thank you. I yield back.
Thank you, Ms. Steele. Now recognize Mr. Evans of Pennsylvania.
Thank you, Mr. Chairman. Mr. Lloyd, you highlighted the importance of mentoring as one of your policy recommendations in your testimony, which you know is important. How can we better incorporate peer mentoring partners when implementing the policy we are discussing today?
Thank you, Representative Evans, for the question. Yes, I think it's in some ways about encouraging states to prioritize things like peer mentoring and other mentoring services. Title IV-B would be an opportunity to designate young people as a priority population for services like that. And it's also an opportunity, I think, to revisit the Chafee program because funds currently exist for mentoring, but in the report you see that few youth are actually receiving those types of services.
If I piggyback a little bit on Mr. Kiefer, when Mr. Kiefer said what he said about long-term commitment, the question really is how do you get people to understand that this is important if they don't seem to understand? Now, you would agree they sometimes don't seem to understand. Right. Mr. Kiefer said very emphatic. So yes. I'm just trying to, not that you have a magic wand, I'm just trying to understand. Right?
Absolutely, and I think that what we see is that the stability in placements, changing placements too many times, or stability of the caseworker, too many social workers involved, the likelihood that they'll achieve lifelong permanent connection goes down. So we really need stability of relationships, and I think it's to your point about the mentoring. So I think it's helping mentors and mentor programs understand that there needs to be that long-term connection. It also relates to the real core objective of child welfare when youth come into foster care to promote permanency for them. The best way to do that is connecting them back to relatives, extended relatives, and kinship members of their family. They're the most likely individuals to be in it with them for the long haul.
I yield back to Mr. Chairman.
Thank you, Mr. Evans. Now turn to Mr. Smucker of Pennsylvania.
Thank you, Mr. Chairman. Thank you to each of the witnesses for being here today, particularly Mr. Otero and Ms. Barra. Thanks for sharing your story. We appreciate that. Mr. Kiefer, great job today, and you've been asked a lot of questions about what has made your program successful. You've talked about the long-term care mentoring. One of the other things I've noticed is that you're nimble in terms of creating new programs to meet the needs of the kids who come through the program. And I was going to ask you a little bit about that. You also mentioned you have Kenny, your son, here with us today, and you said he's available to ask any questions. So with your permission, I was going to ask you about the program, but I know that Kenny's been through Benchmark and many different programs. I'd love to hear from him. What was that experience like for you? Tell us about. Sure, do that. We'll kick Will out for a minute. You can tell us about how you experienced Benchmark in your life.
Well, as mentioned earlier, I was first at Benchmark when I was 14, so I was glad I went there when I was 14 because Will became my mentor. I left for a little while, 16, and then I came back on probation. And during that time, as mentioned, I lost my father, my mother, and my brother. And then Will offered to take me in because I had nowhere else to go. And ever since then, he, of course, adopted me, became my father. And I've just appreciated it so much because, the common theme here has been support and guidance, and that's what all foster children need is support and guidance as parents are supposed to offer. And Benchmark has offered that for me countless times, and I've given everything back to Benchmark. Every time I step in there, I help with every break I come back from school, my first thing I do is work at Benchmark, help the kids. I stay in contact with the kids that I help, are in a similar situation than I am. And we just, keep that ping pong conversation back and forth all the time. And I've just loved Benchmark, and I support it, and I will, always support Benchmark, donate my money to Benchmark, and also start something just like Benchmark to help children just like me. But there was something I was thinking about. We're talking a lot about like parents and stuff, and how like I think that's the main a part of the problem we should try to deal with there, because it comes from your parents, and our parents' burdens come onto us. Just like making it a policy, moving forward, something we could do is get parents help with knowing how to take care of children, and support them and move forward, because that's really where it all starts, is our parents. But Benchmark has helped with many kids, and I see it every day. I'm so grateful to be able to go back and have, of course, have Will as my father now, but it makes me a bit emotional knowing that, this is how far we've come, and I'm very proud of him and everything he does there, and thank you.
Well, thanks for sharing, Kenny. I very much appreciate it.
Of course.
Thank you so much. Wonderful story. And Mr. Kiefer, any additional things you'd like to say about Benchmark and the programs? I know you have a number of different programs, as I had mentioned. Any other particular things you'd like to highlight?
Thanks, Congressman Smucker. The only other thing I'll add is that we generally throw programs to kids knowing that they are wonderful resources for them. But if those programs don't connect to each other, I think we're doing a disservice to the kids who are in them, because we're setting them up for these short-term engagements that are very positive, but then systematically don't offer a long-term. So again, from the minute that a kid is housed in our local Lancaster County Intervention Center for a delinquency issue or a dependency issue, they can get a Benchmark mentor. And we'll just begin by showing up at court, seeing them weekly in the detention center, and walking them the whole way through. If it's delinquency, the whole way through their time on probation. If it's dependency.
I know you're also focused on jobs now, and then maybe that's a new focus for you, or you're increasing your focus on that. Tell us a little bit about what you're finding, the support from the community, what is working, what's not with that.
We found, interestingly, as Mr. Evans brought up, that peer mentorship, offering a job to a young person who's succeeded in our program to serve as a peer mentor, is wonderful to give back, but also builds their resume in a huge way. And then we bring community members in who work in businesses in the community. They see these individuals. They get to know them. They look at their resume and say, geez, you've worked at Benchmark for 2 years. I'd love to talk to you about working here at my business. And we've seen that to be a very, very effective step-by-step through our program, through working on our program, to getting a job elsewhere.
Well, thanks again for being here. Our community is very fortunate to have you there. Appreciate your work. Thank you.
Thank you.
Thank you, Mr. Smucker. And now recognize Mr. Smith in Nebraska, who's a former chair of this subcommittee and passionate about this issue area.
Thank you, Mr. Chairman. Thank you to my colleagues as well, and certainly thank you to our panel. Your professional perspective, more importantly, I would say your personal perspective, being vested in this issue, all of you, it's very compelling. And there's one thing that I've noticed, it doesn't take a lot to observe this, but the repeated reference to human interaction and the value that that has. That, I fear that over time, we've tried to help people, I think well-intended, we've tried to help people by qualifying them for various services, setting them in front of a computer, hit a few buttons, okay, you qualify for X. And yet, the more important dynamic is that interaction with a human being, whether it's caseworker, whether it's a mentor, whether it's an employer, certainly a family member when possible. And I also know that it's hard to get folks to step forward. I was just wondering if you could perhaps elaborate on what we should be mindful of, or just what you want to remind us of that's important in terms of engaging these folks who can bring so much in terms of mentorship and that human interaction that is so effective ultimately. How can we generate more available caseworkers and other mentors as well? Maybe, if we can, maybe a little bit from all four of you. Mr. Lloyd.
Okay.
Thank you for the question. Yes, I think there's a real opportunity in this current package with Title IV-B to reauthorize this to stabilize the workforce. It is a system that's balancing so many competing priorities, and we really want to see that consistency of a caseworker being connected. I would also just say too that the permanency efforts for young people, identifying kinship families and other foster families, recruiting them and supporting them well, and even financially incentivizing states and positioning states well through cost sharing to support families is critical. We did some national polling at one point, and it was nearly 30% of adults in the U.S. had considered becoming a foster parent. If even 1% of adults in this country moved forward with that, we wouldn't have a problem with foster care and adoption.
Thank you. Ms. Baer?
Thank you. So when it comes to these issues, and especially with mentoring, creating programs or finding ideas for it, I feel like it's always very important to gain authentic youth voice from all areas, so including working with tribes or even with other youth that diverse youth. Recognizing that mentorship is a two-way street, so working with the young people as well to recognize it's a working relationship. A lot of young people, when we get a mentor, we feel that that's somebody we can call when we're upset, but we don't recognize like that we could also help contribute to them as well. And something that my mentor told me was that she expected that out of me, and that helped me recognize how to build a relationship, because a lot of us didn't know how to build those relationships. And then also having connections, something in common. We had to figure out, I had to fill out a sheet of paper, and my mentor did too, to get connected. So matching kids with random mentors doesn't always help. So recognizing that as well. And then lastly, I always like to say more male mentors, because we find that a lot of females do volunteer to be mentors, and there's a lack of young men or men in general that volunteer. Because I had a mentor my entire time, and I've had her for 10 years. And my brother, he had a mentor who just disappeared, and they just didn't show back up.
Thank you.
Thank you, Mr. Smith. Speaking from my own personal experience, my wife, Carla, and I never planned to foster and then adopt Kenny. But we had a window into his life through our program, so that when these things happened in his life that made this opportunity available to us, it was a no-brainer. But it was not a foreign thing to us. The concept of doing it was not in our plans, but knowing him was the key. We knew right away that we would be happy to do it and be with him for as long as it took. But it was because we knew him ahead of time, and we had gotten to know him through a community-based program.
So familiarity.
Correct.
Very good. Thank you. Mr. Otero?
One thing that I can tell you that would benefit mentoring is if we got the youth who've been through this, if to use their college degrees or go into college to then give back to the system. Like myself personally, I'm a home-based caseworker, and I see that I can relate to these kids on a level where they're understanding that I've been through it. I can tell you the programs because I've done them. And here's the real life benefit of this. This is the exact money that it could increase here. So incentivizing, there's a program that's being piloted by a couple agencies in Indiana, peer mentoring of former foster youth who are now working with current older foster youth that are aging out of care. And I think that's an amazing thing, because getting someone who's been through the system to help someone else navigate that system is an amazing thing. And so I would incentivize more states to do that. So.
Thank you. Thank you to our all-star panel here today. Really appreciate it. I yield back.
Thank you, Mr. Smith. Recognize Ms. Sewell of Alabama now.
Thank you, Mr. Chairman, and thank you, Ranking Member, and all of our guests who are here today. You know, one of the things that Kenny said that really resonated with me is that the common theme when you're talking about helping youth, foster youth, is support and guidance. Support and guidance. I wanted to make sure that all of my colleagues knew that there is a foster caucus, a congressional foster caucus, and they put on every year a foster youth shadow day. And one of the things that I think that we can do, aside from making better policy and passing a reauthorization of Title IV, is to be involved, to actually accept one of the foster youth that day to shadow you. I did it, and I have to tell you, I was completely ignorant as to what was going on in my state about foster youth until my classmate, Karen Bass, Congresswoman from California, now the mayor of LA, started this shadow day. And I can't tell you how rewarding it is to meet someone from my state who's experiencing something that I don't know anything about. And I have been educated by those wonderful youth. And I just want to say to all of you, it is hearings like this, firsthand accounts like you, Ms. Bear, and you, Mr. Otero, that really give us an eye into what's going on. But we can't do it alone. It's not about just money. It's also about making sure that we have good public-private partnerships that are there as a safety net. And so my first question is to you, Mr. Lloyd. I know that you represent a foundation that is that has taken as one of its missions working on this, but can you speak to other public-private partnerships that exist?
Yeah, one example of that is a program we call the Opportunity Passport. It's a match savings account. We have helped 20 states develop this, and they've leveraged $85 million in support of the initiative's programming. 35 of that is from private investment of probably about 80 foundations, including ours. We invest about $1 million in that. We match young people dollar for certain asset purchases as they transition from care. The number one asset purchase is a car, right? Which is no surprise.
Exactly. I actually wanted to ask Ms. Bear if she could, because I noticed that you have a connection with the National Foster Youth Institute, and I know that Congresswoman Bass, now Mayor Bass, was really influential in starting that initiative. Can you talk a little bit about why that was so important? And can you tell me what do you see as the difference between yourself and other foster youth that don't go to college, that don't get out of high school? If you could sort of say what the difference was, that would be really helpful, or at least talk about your own experience.
Yes, thank you. So the first thing is about the shadow day being so important. Although I didn't get to shadow the person that was from my state, I got to learn a little bit about South Carolina, and I got to meet with Representative Nancy Mace.
Yep.
And got to learn a little bit about what's going on over there, got to educate them, and then honestly got to learn a little bit about what goes on every day here, as
In
well
Congress,
as
yeah.
as well as get a little trip. I got to go onto the top of the roof and see that. Like,
Oh, you got to do that?
I did.
Good
It was
for Nancy
really cool.
to do that.
Yeah, it was awesome. But it really gave me the recognition that it's really important what's happening up here, and I would love to be up here every day advocating for change. So I'm working on making my way up here.
Yeah.
But that was really thanks to NFYI, or the National Foster Youth Institute, and helping us get into that. And then when it comes into the difference of foster youth, I feel that one of the biggest reasons that I'm sitting here today was because when I had entered the foster care system, I knew that I wasn't supposed to be in the foster care system, and my family needed minimal services. I was 16, and I could speak for myself, but my voice was stripped in the courtroom. I wasn't allowed to talk in there. And so I essentially made it once my judge at one point told me that I would be a failure in life if I didn't go home to my mom, which I didn't know was an option at all. I made it my mission to show my judge that I'm going to be a successful young adult, to the point that I was a homeowner at 21. I bought my own car. I have my started a side business with I bake a lot. But not everyone has that opportunity to recognize what they can do when they're older.
Yep.
And they don't have those supports there. I mentioned my mentor earlier. I had my dad that stuck it out by my side. He was fighting to get us home, and constantly just fighting for us tooth and nail. And not every child has that. And I try to be that support for those young people in the state of Florida, and try to help them get to where they believe would bring them the most success.
Well, thank you all. And Mr. Chairman, I just wanted to acknowledge what a great hearing this has been, and once again to encourage all of the members on our subcommittee to participate in the Foster Youth Shadow Day. It really is. I think I got more out of it than my mentee, but it was really, really rewarding, but also very, very informative.
Thank you, Congresswoman Sewell, and appreciate you reminding us of the caucus. We'll now turn to Ms. Tenney of New York.
Thank you so much, Mr. Chairman and the ranking member. And thank you, Representative Sewell. I did not know about that. It sounds like a tremendous day, and I would certainly join the caucus and would love to be part of the day. Oh, great. Well, that's terrific. even better. Wonderful. Well, thank you so much to all of you. What a wonderful experience. Not every day in Congress is bad, especially when you get to meet people like you, where you're so inspiring and have really faced struggles and challenges. And this is an important program. And I just thought I'd share a few facts just about my home state. I'm from New York, and enabling people to transfer out of foster care is really important. And we have over 25,000 children in foster care, and only 3,000 are moving out of care at this point. So as you cited, we have Mr. Lloyd, we need to find foster parents, we need to find mentors, we need people that will do this. I was lucky enough to be the daughter of a Supreme Court justice. My dad was 35 years serving, but his little-known story is he was a very poor kid from New Jersey that kind of worked his way through life, and he was always very concerned about fostering people who didn't have a mentor and someone who didn't have a person to look up to. And he always instilled that in us. In our family business, we do provide opportunities for people that have been in foster care. We provide opportunities for people who have a lot of other obstacles to getting gainful employment. So almost universally, anyone that comes out of foster care becomes a tremendous asset to our company. And so I appreciate all that you're doing in getting you these kids to this point. But I wanted to just ask a question first to you, Mr. Lloyd, and what can we do in the system? How do we make this system? Is there something we can do to overhaul the Child Welfare Services program and by reducing the fragmentation? And by redesigning it, when you're talking about reimagine, redesign, can we bring and streamline this system to include this so that we do have, meet the goals of the consistency of care, the long-term goal of having one mentor or one system where someone can turn to? Could you just maybe briefly touch on that for a minute?
Absolutely. Yes, I'd first like to just congratulate Congress for really setting a vision time and time again for the child welfare system to be recalibrated. And I do think that there is a need, to do some major redesign of child welfare. Child welfare, unfortunately, has become a catch-all, a social service catch-all, right? When there's lack of housing in the community or substance use disorders and many other things, they look to child welfare. It's sort of the lowest common denominator in the community. And so we really need to help the child welfare system focus on families who are really, truly in crisis and who need that kind of intervention, a much narrower set, and find other ways to kind of work collaboratively and across funding streams to strengthen families and communities and provide that stabilization.
Well, thank you. I appreciate that. Now, I wanted to just also ask, because I have a dear friend who's actually a businessman in my community who grew up in foster care. He was raised at the House of Good Shepherd and then went into foster care in upstate New York. And he is now a very successful business person. And he tells his story, and I've had him testify for me in Albany and other places on his journey out of foster care and into success. And I asked him just now, I texted him a little while ago, who were your mentors and who was the most influential to you? And you know what? He said there were so many people that impacted my life, but he did say that one of the things that we could do is allow more flexibility in the program so that we could have access to more mentors. And I thought that was his idea. He also provides foster care students or young people to come to his business. So how do you incorporate that? And I love the idea with the business community, bringing them into play. How do we do that? Is that something we can do under the child welfare system? Is that possible?
Yeah, thank you for the question. Yeah, there is definitely situations where mentors, and I'd even say kinship caregivers, grandparents, relatives, are actually not eligible to take in children because of certain licensing requirements, aren't able to be licensed as a foster parent. The administration recently sent out new regulation giving states the option to have kin-specific licensing standards so more of grandparents and relatives can become foster parents. When they're not foster parents, they get less than half of a foster care per diem rate, and that's only if they're eligible to get a TANF child-only payment.
Okay.
If they have 2 or 3 children, it can be 3 times being a licensed foster parent versus what they would get through TANF.
I know my time's expired. Just one quick thing on what Representative Sewell had mentioned about the foster care shadowing day. Maybe we should each bring some business that would be willing to offer opportunities for a foster care person and meet them, and that would help get them connected, because that's what it's all about, isn't it? About having connections and taking advantage of those things as you move through life. But I just want to say thank you to all of you. You're very inspiring, and it was really great to hear from you. And hopefully we'll make some great changes and good services to the taxpayers as we move forward. Thank you, Mr. Chairman. I yield back.
Thank you, Ms. Tenney. Our last member who will question today is Mr. Feenstra of Iowa. He doesn't serve on the subcommittee, but he wanted to be here today because of his interest and passion for this area. We'll recognize Mr. Randy Feenstra of Iowa.
Thank you so much, Chairman. And this is very important to me. I just came off the floor. Member Kildee and I had a bill that we're moving forward and that will be voted on by the members of Congress concerning foster care data. We feel that there's so much going on in so many different states, but we really don't have the data to create solutions to the problems that exist. And I just want to give all of you a shout out for your testimonies. I read them. Unfortunately, I was on the floor, so I couldn't hear them verbally. I apologize for that. But I read them, and they were moving. They touched me. In Iowa, the great concern and why I'm so passionate about this is that we've lost almost a half of our foster care parents in the last 4 years. There's a problem. We see that in D.C., we see that in many other states, and so we got to come to a solution of what's happening. You know, I also see that 19,000 youths age out of the foster care program, and are they ready for success? You know, that's a concern. All of a sudden you age out and you're on the street, or you could be. That's scary. What are we doing to make sure that we're preparing them for success? I know there's an enormous amount of good people in the world, in our nation, and they strive to improve our foster care system and support those within. Obviously, we have many of those here. But I'd like to talk about two key aspects, the kinship foster placement and nonprofit organizations. Mr. Lloyd, you discussed the Casey Foundation report and the positive trend and the shifts toward kinship placements. But what struck me is what you just said, is that when you start going down extended relatives, that they all of a sudden have a disadvantage, that they're financially. And this could have dramatic effects when there's this financial vulnerability. So I'd like you to just talk a little bit more about that, what you are seeing and the vulnerability that we're putting when we have a child that goes into these placements, that the money is not there to help financially.
Thank you for the question. Yes. Earlier today, there was a mention of just the stigma associated with child welfare. And some relatives are frankly fearful to working with the child welfare agency. And so they'll sometimes take in children or, into their home and don't want to necessarily have any relationship with the child welfare agency, don't want to become a licensed foster parent because they fear they could lose their grandchild, right? So there's a lot of concern around needing to prioritize kinship caregivers, support them better, encouraging states to do that. And so just better positioning them, because we think that that's really the key. Some states are searching for relatives to the 5th degree of consanguinity and affinity. I don't know how many of us even know our relatives that far out. That's great, great, great grandparents.
Yep. Wow.
Okay?
Wow.
And so that's what it's going to take if we want to have families to step up for children, and we need to support those families when they come. And if it makes sense for them to be a licensed foster parent, we need to do that.
Yep.
And we need to support them well. There are states that are not financially supporting kin who are licensed at the same rate that are supporting foster parents who are not relatives. It makes no sense.
It doesn't. And we got to solve these. There's a solution to be had right there. Thank you for those comments. Mr. Otero, thank you for your testimony. I applaud what you wrote. You were placed, obviously, with your grandmother that we were just talking about. What is the most significant challenges that you saw with your grandmother through the foster program? And I'm, again, looking for solutions. How can we improve? What would you tell me? Member Feenstra, this is what needs to happen. What do you think?
So what I think is that I do love the idea of kinship, and I love that I was placed with my grandmother. My grandmother was the best thing that ever happened to me in my life. However, I want to keep in mind that we cannot lower the standards of these homes because they are kin. I've seen it firsthand. Not being my grandma loved me, and she loved me more than anything, and she would sacrifice her sleeping on a floor so we could sleep on a couch because we didn't have a bed. You know, and the reality of it is, if you can make it look good for one DCS day when they come to see that house, then you look good one day, and then they say, okay, we're done with you. You can have these two kids. And then my mom and dad ended up having two more kids that live with my grandmother. So we had four older ones in foster care, four of us living at my grandmother's, sleeping on the floor, sleeping on couches. And the fact of the matter is that if we just gained any little bit of financial support, we would have been able to move out of, we live in Gary, Indiana, which I'm sure you know all about Gary, Indiana. You've heard of it at least once. And so, you know, in that circumstance, we can't lower the standard, but if we can provide the financial support, then these homes, I mean, they can support them better. If you wouldn't let your own child stay in these homes, why would you keep these kids here, you know? And I see that every day. I've seen DCS allow kids to stay in these homes that are infested with bugs or have no paneling because it's kinship, and they pass an inspection for one day. But then when I enter the home and I see that, I say, they wouldn't let their own kid, they wouldn't sleep there themselves. Why should these kids? So
Great comments. Thank you. And it's our responsibility to do something about it. And thank you for coming. I yield back.
Thank you, Mr. Feenstra. That concludes the questions and our answers today at this subcommittee hearing. Let me just say to our witnesses how grateful we are for you being here today and how much you've contributed to this dialogue and discussion. And in particular, Rebecca and Jordan and also Kenny, you give us hope, you inspire us by being here today and sharing your stories. And Mr. Lloyd, Mr. Kiefer, thanks for your expertise, your experiences, what you've brought to us here today, and for sharing everything you have today. We can't do this work without you and without people in the field sharing with us how we can do things better from a public policy standpoint. And as we look at our work ahead in a bipartisan way, we look forward to continuing to stay engaged with you, getting your thoughts, and making sure we're doing everything possible to change the trajectory on those statistics I gave earlier and what we need to do better, because we have plenty of work to do moving forward. I'll just remind members that you have 2 weeks to submit written questions to be answered later in writing. Those questions and your answers will be made part of the formal hearing record. With that, our hearing is concluded today. Thank you. Safe travels.